All right. Okay, well, welcome everyone. Thanks so much for joining me this morning for Advanced Searching in PubMed. We're going to be talking about a little bit about PubMed in general, but mostly about sort of advanced comprehensive search strategies in PubMed. My name is Erin Reardon. I am one of the public health informationists here at the Woodruff Health Sciences Central Library. My contact information is here on this slide, and I'll also share these slides with you uh, after the class today. So today we're going to be talking about kind of three big areas. We're going to talk about topic searching or kind of exploratory searching versus comprehensive searching in PubMed. We're going to talk about the building blocks of comprehensive searches, and then we're going to build a comprehensive search together. So here's a little bit of information about PubMed. So PubMed is the premier database for health and biomedical literature. Health and biomedical, that field is actually really lucky that we have a database like PubMed. In a lot of other disciplines, you have to go to lots of different databases to find information about your topic, but in the health sciences, you can find a lot of stuff just by going to PubMed. Now, it doesn't contain everything because there is no one database that contains all the literature everywhere. But PubMed contains a lot, and when you have to find everything, you're going to be looking in a couple of different databases anyway. So PubMed is created and housed in the National Library of Medicine, which is in the National Institutes of Health. It is free to the public anywhere in the world to search, but access to individual articles is going to be provided by your institution. So for you all, access to individual articles is going to be provided by Emory Subscriptions. There are over 5,600 peer-reviewed journals that are indexed in PubMed, over 30 million records with more added every day. And it covers from about 1947 to the present. So you might be familiar with topic searching or exploratory searching. You might not call it that, but this is when you go to a database or even to Google and you type in the thing that you're looking for and you start like reading a little bit about it and you learn a little bit about that topic, and then maybe you can like do a better search if you want to find something that's a little bit more specific. So then you go back to the search box and you do another search. If you're in PubMed, you might be looking at like related articles in the PubMed record. You might be looking at the references to kind of see what are some other articles that are about this topic. And you're sort of following these breadcrumbs from article to article and kind of getting a picture of some of the literature that's out there. So topic searching can be used to find like a handful of articles about a particular topic. This can also be used, excuse me, if you want to identify a piece of high-level evidence to support a clinical decision, or if you're just kind of trying to get like a broad overview of literature on a topic, is when you will kind of use topic or exploratory searching. So there is another kind of searching that we call comprehensive searching. And this is when you want to capture everything or close to everything you can about a particular topic. And you might want to do this if you want to identify gaps in research. So see what's being explored already, where are there avenues for future research. If you are writing a literature review for a publication or for like a grant application, you want to have a good idea of what all the literature says and not just what like 5 articles that you found randomly say. If you're writing a policy or a protocol for a hospital, is another reason that you might want to do a comprehensive search. And the thing about comprehensive searching, the way that we're going to talk about it today, is that it's replicable. So if you need to run this search again in 5 months, you want to find what new literature has been published in that same area, you can basically copy and paste the search that you built today 5 months from now, and it'll run the exact same search and find the exact same articles plus anything that has been added since then. When you're doing a topic search or exploratory searching, it can be easy to sort of lose track of like, well, what did I enter to find this one article? And how do I get back to that? And how can I find that again? Like, how can I find more articles like that again? But in this comprehensive search, we're being very exacting and we're telling PubMed to search for only exactly the things that we enter the way that we enter them. And then we can replicate that later if we need to. So here's an example of what a topic search might look like. So you're using a simple keyword search. In this example, it's vitamin C cold. By default, PubMed is going to sort the results by what it thinks is the best match to your query. So this is what PubMed thinks is the best match. It doesn't always line up with what you think is the best match, but it's trying, which means that the most relevant results are going to be pushed to the top. So this article was published in 2013, so it's, kind of old, but it's vitamin C for preventing and treating the common cold. It's kind of exactly what we were looking for with this topic search. A comprehensive search, on the other hand, is when you are combining mesh terms and keywords, and we'll talk about what mesh terms are in a little bit. You're going to use quotation marks, field tags, nested concepts with parentheses, and then you're going to kind of build out each concept individually and then combine the two of them. So this search was looking for kind of disparities within the treatment of triple negative breast cancer. So we took one of those concepts, triple negative breast cancer, built it out with mesh terms and keywords. We took this other concept of like disparities, built it out with mesh terms and keywords, and then combined the two of them to find about 100 articles together. So to effectively search PubMed, or really any of these like academic databases, you kind of have to like think like a database. So PubMed doesn't understand context very well or categories, so it'll typically only search for the words that you entered. So if you search for this phrase maternal and child health outcomes, PubMed doesn't know that you mean like anything that's under that umbrella. It's just looking for the words maternal and child health outcomes. And that can mean a lot of things. That can mean different things depending on what your area of research is. But it could mean like pregnancy complications, it could mean like maternal or fetal mortality, it could mean maternal or infant morbidity, labor complications, preterm birth, low birth weight, infections. And you can even drill down a little bit deeper. So you could take one of these sort of concepts here, pregnancy complications, and you could drill down even further. Like that could mean all sorts of things too: preeclampsia, hypertension, anxiety, diabetes, infection. So when you're searching pregnancy complications in PubMed, it doesn't know that you mean any of these things. It just looks for those words, pregnancy complications. So that's why you have to be kind of intentional about brainstorming keywords to use and trying to find the mesh terms and the keywords that will encompass what you're looking for. So to search PubMed comprehensively, there are some building blocks of searches that are gonna make your life a little bit easier to build this search out. So we're going to talk about Boolean operators, truncation, quotation marks, parentheses to kind of separate concepts out, field codes, and index terms, which are also called mesh terms. So you might already be familiar with Boolean operators. These are the words and, or, and not, and they are just words that you type in to link together different keywords or different concepts. So if you were to type in the search vegan and vegetarian into PubMed, you're going to find all of the articles that mention both of those. So there's all these articles that say vegan, there's all these articles that say vegetarian. If you're looking for vegan and vegetarian, you are only going to find that overlap, articles that mention both of them. If you want to find articles that are about either of those concepts or both of them, then you can search for vegan or vegetarian, which will find all these vegan articles, all these vegetarian articles, and everything in the middle. Now, there's also the word not that you can use, and I kind of recommend not using it very often, if at all. It's a little bit tricky because if you're looking for vegan, not vegetarian, you're going to find these articles that say vegan, but you're also going to miss these articles that say vegan and vegetarian in them because you're getting rid of vegetarian. You don't want it at all in the search. So these articles might be relevant to what you're looking for, but you're not going to find them in the search. So that's why not is like a use sparingly kind of tool. And here's what that looks like in practice. So I just did a search in PubMed for vegan and vegetarian. I have about 1,700 results, and we can see from the results where it's bolded, that's kind of picking up the keywords that we entered. We can see that it's picking up vegetarian and vegan. If we look for vegan or vegetarian, we're going to have a lot more results because we're looking for all the articles about one and all the articles about another one. So this is closer to 7,500 results. And you'll have, a lot of the same articles in here. We can see we've got vegetarian and vegan or vegetarian diet. We're also going to find articles that just talk about a vegan diet or that just talk about a vegetarian diet. Now, if we say vegan, not vegetarian, that's going to cut our results down by a lot. We've only got 500 here, and that's because we are specifically saying I don't want any articles that mention vegetarian, which means that there might be articles out there that are relevant, but we're not going to find them. So not use sparingly. So truncation is a way to simplify your search a little bit. And also it's a way to simplify your search and also like open up more options in your search strategy. And it's a little bit tricky and it takes some practice to get used to. So truncation is when you basically cut off the end of a word and you put an asterisk there, and it will find all of the words that begin with that word. So if I take the word vaccine and I put an asterisk at the end of it instead of an E, it's going to find articles that use the word vaccinate, vaccination, vaccine, vaccines, etc. If you do that with the word prevent, you'll find articles that are using the word prevent or prevents or prevented or prevention or preventions or preventative, all those sorts of things. So this can be a little bit tricky sometimes because you might truncate a word and then you get some unexpected search results. So I was doing a search about stomas one time, and there you can say stoma, stomas, stomata, and I'm like, I'm just going to make this easier on myself. I'm going to say stoma asterisk. That's the end of it to capture all of that. Well, then I start looking at the results and the word stomach is there, and I don't want, like, I'm not looking for something that has to do with stomachs. I'm looking for something that has to do with stomas. So that can be a way that truncation can go a little sideways for you. So this is something that becomes a little bit easier with practice. You start to learn, like, where can I truncate this that's going to give me the best number of results? So I took the word vaccinate, truncated it, and so you can see in the search results, we've got vaccination, vaccination, vaccination. It's also going to have the word vaccinate, vaccinated in there. If we drop that down even further and it's just vaccine with an asterisk, we'll have vaccine, vaccination, vaccines. You get it. And if we do that with prevent, you'll see from these bolded words, we've got prevention, prevent, 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 prevention, prevents. So it's going to find all of those articles that have that word in there. So quotation marks can also be a little bit tricky. So you can use quotation marks around a phrase to look for that exact phrase, which sometimes you do want that exact phrase, but sometimes you don't want that. So you want to use quotation marks a bit sparingly. So you want to think about what authors are describing a topic as in the literature. So I think this is easiest to show through some examples. So if we look at the example, triple negative breast cancer without quotation marks, PubMed is looking for all 4 of those words in any field in the PubMed record. And we'll talk about fields and records in a little bit. If you put quotation marks around it, PubMed only looks for that exact phrase in any field in the PubMed record. And this is what that looks like. Triple negative breast cancer, no quotation marks, about 23,000 results. If we put it in quotation marks, we've got about 16,000 results. So then it becomes a matter of, is there stuff in the larger set of results that's relevant to me? And do I need to make sure that I include those as well? Because this is only going to find that exact phrase, triple negative breast cancer, but triple negative breast cancer also has other names. It also can be called like triple negative breast neoplasms, that sort of thing. So you want to be a little bit careful with quotation marks. And again, it comes with practice and sort of feeling out the results. Like, is this getting me what I want? Am I going to miss anything that's relevant? And we're thinking about doing this in the context of comprehensive searching. And so that's when you want to make sure that you are capturing all of those relevant articles. So you will want to kind of test it out and see like, well, what am I finding in this search that I'm not finding in this other search? So here is another example using the phrase maternal and child health, 30,000 results. It's only finding articles that have that exact phrase, maternal and child health, maternal and child health. If we don't put quotation marks around it, we've got a lot more articles. And we've got articles that are relevant. This one says maternal, newborn, and child health. That's about maternal and child health, right? This one is maternal, neonatal, and child health. That's in the same vein. Like these are relevant articles. So this is one we would want to be careful to not use quotation marks. Water sanitation and hygiene is a concept in public health called WASH. So if we search for that as an exact phrase with quotation marks, we're only going to find these articles that say water sanitation and hygiene, 1,300 results. If we take away those quotation marks, we've got over 4,000 results. Water sanitation and hygiene articles are going to be found where it will mention like sanitation somewhere in the abstract, it'll mention hygiene somewhere in the abstract, or water somewhere in the abstract, but not as that exact phrase. And there's going to be articles that are relevant that you would miss if you used the exact phrase. So you can use parentheses to kind of group related concepts together. And this can be useful when you want to find the overlap of 2 different concepts. So if you were to take the concept of skin cancer, you might want to look for other words that are related to skin cancer, like melanoma or squamous cell carcinoma or basal cell carcinoma. So if you put all these together and you use the word or in between them, you're going to find articles that are about any of these, that mention any of these words in it. You can also use the word and to connect unrelated concepts to find the overlap. So we've got vegan or vegetarian diets, cholesterol or blood pressure, but we want to find the overlap of both of those concepts together. So we would use and. So if we just look for skin cancer in PubMed, we've got about 28,000 results, we're only finding the exact phrase skin cancer. If we look for skin cancer or melanoma or squamous cell carcinoma or basal cell carcinoma, we've got a lot more results. And you can see that we are finding articles that are about all of those here in the results. So if we look for vegan or vegetarian, we have that 7,500 results. These are all articles that talk about vegan diets or vegetarian diets. If we look for cholesterol or blood pressure, we've got 780,000 results. That's talking about cholesterol or blood pressure. We can combine the two of them, vegan or vegetarian, and cholesterol or blood pressure. We've got 962 results, and these are going to be the overlap between both of those concepts. So field tags are something that we use when we're doing a comprehensive search to make the search more exact. So by default, when you search for something in PubMed without any quotation marks or field tags, PubMed is going to do a search in all fields in the PubMed record. It's also going to look for some word variations, and it's also going to try to find the MeSH term that is most appropriate for the search term that you entered. And we're going to talk about MeSH terms next. So instead of looking in all of these different places, we only want PubMed to look for the word or the phrase that we entered in one place exactly, or in like kind of a category of places in the PubMed record. Let me show you what that means. So when PubMed is looking in all fields of a record, that's like anything that you can see when you pull up a PubMed record. So this is a PubMed record. You can see that it is a review article. It's in a journal called Annual Reviews of Pathology. You've got the date it was published, you have the title, you have the authors, you have the author affiliations, which will be listed here, like someone from Emory University would have Emory University in their affiliations. You have the abstract, there's keywords, there's MeSH terms. There are some fields that are hidden that we can't see that PubMed is also searching when it searches for all fields, which seems fine, right? Like I want to find, the word, if I'm looking for like rice, I want to find rice in any of these fields. However, someone can be named Rice, someone can work at Rice University, and their article has nothing to do with rice, the food, but it's because PubMed is looking in all fields, it's going to find those articles that are by authors that are affiliated with Rice University. So if we use field tags to only look in certain places, then that kind of cuts back on all of those irrelevant articles. So here are some field tags that you might end up using. So TW is for text word. This is probably the most common one to use. So TW is looking in a lot of the fields that you see, but not in those like author names or author affiliation fields, or like the journal title or anything like that. You might want to look for words only, in the title. So you would look for like diabetes in the title or orthopedic surgery only in the title of an article. So this is a good way to find articles that are super relevant. Maybe not necessarily when you're doing a comprehensive search, because an article might not use the exact word that you want in the title, but it could be in the abstract somewhere. If you want to look in title or abstract, you would use TIAB. You can use field tags with phrases in quotation marks. You can use field tags in with just keywords. You can also use them with truncation. So stomach in the title or abstract, stoma, anything that starts with the word stoma in the title or abstract. And then there's also the field tag for a MeSH term, which you don't have to like keep track of the MeSH term and make sure that you put MeSH, the MeSH field tag on it. When we look for MeSH terms in the MeSH database, it'll automatically do that for us. And I'll show you how that's done. So here is a search for melanoma. By default, it's looking in all fields. This is the history and search details. When you click on advanced in PubMed, you can look at the search history. So when I type in melanoma, PubMed looks for the mesh term, melanoma. It'll look for melanoma in all fields. It'll also do some word variations like melanomas. It does this weird like word space S in like every search that I've ever tried. It does that, which I don't think is very helpful, but there you have it. In all fields as well. So this finds 160,000 results. If I look for melanoma only as a text word, we get rid of some of those results. So again, this is something that you have to experiment with. Would some of those other articles be relevant? Probably. But again, if you're looking for a word that might be in an author's name, or it might be in an author affiliation, or it might be in like the journal title. So if there's a journal that's specifically about melanoma, when you search for melanoma in all fields, you're going to find that journal and all the articles that have been published in that journal as well. And they might not all be super relevant to what you're looking for. So again, all these building blocks are things that you want to practice with, experiment with, see if it's going to give you the results that you're looking for. So here's that example with rice. Again, if we just search for rice, it looks for the mesh term, which is oryza. It looks for oryza in all fields and rice in all fields. If we look for only rice as a text word, then we've got a lot fewer results. We can also take some things from this as well, and look for those. We can add those to our search. So if I'm like, oh, I like this mesh term, I want to include that in my search, then we can take oryza as a mesh term, add it to our search. We can take oryza as a text word and add it to our search as well. Okay, so let's talk about mesh terms. So MESH stands for medical subject headings, and this is the way that articles are indexed. A lot of the articles in PubMed are indexed. So think of MESH terms as like standardized keywords. So they used to be applied to articles that are indexed in Medline by humans, by actual people who were trained to do this. They would look at the article, say, this article is definitely about melanoma. They add the melanoma mesh term to it. Now it's done by machine learning, but it's still attaching the most relevant mesh terms to an article. So the reason that this is good, and that you want to include mesh terms in your comprehensive search is for a couple of different reasons. So sometimes a disease can have more than one name. And if you were only looking for one name of the disease, you might miss the articles where the authors call it by the other name. If you use the mesh term, you're going to find all of those articles because the mesh term is the same. It's going to be the same term, but it's been applied to articles that are about this thing and articles that are about how it's called something else. So these are organized in a database that's kind of like a hierarchy, and you want to use these in combination with keywords for comprehensive searching. So to look for mesh terms, you would go to the mesh database. So here's PubMed home screen. You go to the mesh database, click on that, and then you would search for the term that you're looking for. So here's a good example of a disease that's called many different things. So if you look for Lou Gehrig's disease in the mesh database, you're going to find the mesh term for ALS. So the mesh database is going to tell you what the term is, a degenerative disorder affecting upper motor neurons in the brain and lower motor neurons in the brainstem and spinal cord. If you scroll down a little bit, you're going to see all of the words that you could type into PubMed that would find this mesh term. So if I typed in Gehrig's disease into PubMed, PubMed would automatically find this mesh term for ALS. If I typed in amyotrophic lateral sclerosis, it'll find this mesh term. But you can see, look at all these different ways that there are to describe this disease. Gehrig's disease with an apostrophe S, Gehrig's disease without an apostrophe, Charcot disease, Lou Gehrig's disease, ALS, Guam disease, dementia with amyotrophic lateral sclerosis. So there's lots of ways to describe this disease. And if I want to find all these articles, I would want to use all of these, like I would want to find a way to capture all these different ways to describe it. So that's why it would be really helpful to use the mesh term in this situation, because the mesh term is going to find all these different ways there are to describe it. And then if you would scroll down a little bit further, you would see how the term is organized in the mesh database. So this is actually found in a couple of different places in the database. It's found under spinal cord diseases, which is under central nervous system diseases, which is under nervous system diseases, which is under diseases. It's also listed under motor neuron disease, which is under neurodegenerative diseases. It's also listed under TDP-43 proteinopathies. It's also under motor neuron disease, which is somewhere else in the mesh database, and TDP-43 proteinopathies, which is also somewhere else in the mesh database. So this is just a way to see, like, how is this actually being organized? Is this the mesh term that I actually want to use? Is it going to find the articles that I'm looking for? So that's mesh terms, super briefly, and we'll spend a little bit more time looking at that as we're building a search together. So we're going to build a comprehensive search together, and we're going to go through this process where we start with a well-built research question, which we're going to cheat a little bit and just use a research question. We're not going to build a research question together, but that's a really important first step, is to have a research question that is specific enough for you to find only the articles that you want to find on it. Not so specific that you don't find any articles though, right? So then we're going to take that question and separate it into its key concepts. Then we're going to build out each concept with mesh terms and keywords. Then we're going to search for those concepts separately and combine them in PubMed's Advanced Search Builder. And then we will evaluate the results and update the search if we have to. So, like I said, we're going to cheat a little bit. We're going to start off with a question, which is cannabis effective in reducing nausea in chemotherapy patients? So the first thing that we're going to do is separate this into its individual concepts. And the reason that we do this, and those concepts are going to be, one is going to be cannabis, one's going to be chemotherapy, and one's going to be nausea. And the reason that we're doing this is because, like we found with some of the other example searches that we looked at, there can be lots of ways to describe individual concepts. And if we want to think of like all of the keywords that we could use, it's a lot easier if we kind of split them apart and list out all the keywords for one concept, all the keywords for the second concept, and all the keywords for the third concept, to kind of find all of those ways that that an article might describe this concept. So actually, let's go back to the research question. Is cannabis effective in reducing nausea in chemotherapy patients? I'm sure there's going to be lots of articles that use the word cannabis and nausea in chemotherapy. There's probably going to be articles that say marijuana instead of cannabis. There's probably going to be articles that say medical marijuana. There might be articles that just say chemo and not chemotherapy. There might be articles that say chemoradiotherapy. And we want to make sure that we're capturing kind of like all of those different combinations. So we've got these key concepts, and we want to build out keywords for each of these concepts. So we'll start with this first one. We kind of talked about some of the words that could be there: cannabis, marijuana, medical marijuana, cannabinoids. An article might be about, the specific element of cannabis that could be helpful in reducing nausea. So that might be a keyword that we could use as well. So then I'm going to look at chemotherapy and think of the different ways that we could describe chemotherapy as well. So that might be chemotherapy, it might be chemo, it might be chemoradiotherapy. And then we go to nausea. We can think about nausea or maybe some variations of that word like nauseous or nauseating or nauseated or specifically chemotherapy-induced nausea. And so these keywords, I am coming up with these like as I'm just sitting there brainstorming keywords, I'm thinking of different ways that authors could describe these. I'm also doing some exploratory searching or some topic searching to see what comes up in PubMed when I search for these words and how other authors are describing these concepts as well. Um, so next we're going to look at mesh terms that we would want to use for each of these concepts. And for that, I'm going to go into the mesh database and we're going to look them up together. So it's always a good idea to start from the library's homepage, either the Health Sciences Library or the Woodruff Library homepage to get to PubMed. So on the Health Sciences Library's website, PubMed is under Quick Links. And the reason that you want to go from the library's website is because then it tells PubMed that you're affiliated with Emory. And you can see here in the URL, EmoryLib means that when you do search for triple negative breast cancer, and you find an article that you want to read, you would click this Find It at Emory button, and that will try and find the article in our catalog. And that's the way that you could view the full text. If you do this and we don't have the article, you can instead request it through interlibrary loan. But if you just go to pubmed.gov without going through the library's website, you're not going to have this button. And then when you do want to read the full text, you're going to have to do a bunch of other steps to get to it. So let's go back to PubMed. We're going to go to this mesh database. And I'm going to look for the word cannabis, and I'm going to see what we find in the mesh database. So sometimes when you search for a word, it takes you directly to the mesh term because that's the only mesh term that there is. Like when I typed in Lou Gehrig, it took me directly to the mesh term for ALS. But we have a lot of options here for cannabis. So there's a mesh term for cannabis. There's a mesh term for medical marijuana. Also for marijuana abuse, marijuana smoking. These ones that are called supplementary concepts are they're usually used for like drugs or drug compounds. I tend to stick with the ones that are just the mesh terms. So I'm actually going to open up some of these and see if they are what I'm looking for. So we open up the mesh term for cannabis. We've got a description of the mesh term here. The flowering tops are called many slang terms, including pot, marijuana, hashish, bhang, ganja. Interesting to know. Sometimes we might want to think about like, oh, should I use some of these keywords as well? So if we scroll down a little bit, we can see these entry terms. So this is what you could type into PubMed to find this mesh term, but this can also be a good place to find more keywords that we would want to use. So entry term for there's marijuana, there's hemp, which might be useful. So you might want to test out some of these to see if you find relevant articles as well. And then you can see that this is listed under, if we take it all the way up to the top, under organisms. So, I mean, it's a plant, so that's how it's listed in PubMed. And we've also got this C also. So we might think about looking at cannabinoids as well and maybe marijuana smoking. Let's look at these. So this is a mesh term for Why didn't it do anything? Okay, we're just gonna have to search for that one on our own. So that's cannabis. I think that that would be a good mesh term for us to add. So I'm gonna click add to search builder here, and then I'm just gonna like highlight that and copy it and paste it onto my list of keywords. And that's exactly how it has to be entered into PubMed to search for it as a mesh term. So I'm just gonna add that to our list of keywords. If we go back to our search results, medical marijuana, what is happening? Okay. So we have this mesh term for medical marijuana. It's a product of the cannabis plant or cannabinoids. There's cannabinoids again, so I'm thinking we might want to use that mesh term too. We look at the entry terms, medical cannabis, marijuana dispensaries. And if we see how it's organized under a pharmaceutical preparation, not just a plant. So this might be useful for us as well. So I would click on add to search builder, and then I would just copy medical marijuana and I'd put it on our list of keywords. Let's look for cannabinoids. So these are compounds having the specific structure. They're originally extracted from Cannabis sativa L, the plant. If we scroll down a little bit, we can see that it is organized under chemicals and drugs, organic chemicals. This might be a good mesh term for us to use as well. So we'll add that one to the search builder just so that we can get it, copy and paste it into our list of terms. So we're going to add our mesh terms for cannabis. So we've got cannabis, cannabinoids, medical marijuana. I also added marijuana use as a mesh term. So there are mesh terms for like the drug itself. There are mesh terms for like using like the action associated with it. There's mesh terms for the plant where the compound comes from. So all of those I think are going to be helpful for us. So then we would do the same thing for chemotherapy. So if we look for chemotherapy, we're going to find that there actually is not a mesh term for chemotherapy, but PubMed wants us to use drug therapy. So if I click on drug therapy, this is the use of drugs to treat a disease or its symptoms. One example is the use of anti-neoplastic agents to treat cancer. So chemotherapy is one of the types of drug therapy. If we scroll down a little bit, we can see everything that is listed under drug therapy. So there's a good question in the chat. So when you search a mesh term, does it show results of all entry terms in PubMed? So when you search for a mesh term, it shows all of the articles that are tagged with that mesh term. So a lot of those articles are going to have those entry terms listed there. Not necessarily all of the articles that have those entry terms are going to have the mesh term because PubMed is actually pulling from a couple of different places. So mesh terms are only on Medline articles, and there might be some articles that don't have mesh terms applied to them, which is why it's important to also use keywords as well. So if you use the mesh term and then you also use some of those entry terms as keywords, then that's going to find the articles that you're looking for as well. So we're looking for chemotherapy. It's under drug therapy. There's a lot going on here. There's anti-neoplastic protocols, there's adjuvant chemotherapy, there's chemoradiotherapy, chemoprevention. If we did a control F for chemotherapy, we're actually going to find that this is listed in a lot of different places under drug therapy. So honestly, I think that drug therapy might be a good mesh term to use, even though it's not specifically about chemotherapy itself, because it has all of this chemotherapy underneath it. So we would add that one to the search builder and then add it to our results. I I see your questions in chat and I'm going to get to them. So what I ended up doing for the chemotherapy concept was that I put in the drug therapy mesh term, but then also chemotherapies as a keyword as well. And then we would do the same thing for nausea. Spoiler alert, for nausea, the mesh term is just nausea. So the next thing that we would do is kind of refine these keywords. So this is when we could bring in some of those building blocks and see if we can make this a little bit easier on ourselves. So the first thing that we're going to do is see if we can get rid of some of these words. So I'm going to get rid of the phrase medical marijuana because I'm looking for the word marijuana. So it's automatically going to find these articles because it has the word marijuana in it. So I don't need to use that one. I also don't need to have the phrase chemotherapy-induced nausea because all the articles, like I'm looking for all the articles that say nausea. So it's going to find this one because it has the word nausea in it. The next thing that we can do is use truncation. So there was a good question in the chat. Can you do more than one truncation in one search to get more results, or is that not necessary? You can do as many truncations as you like. And that's what we're going to do with this search. We're going to truncate in these different areas and add all of those things together. Because truncation isn't just like, it's a tool that you can use for lots of different concepts and lots of different keywords. It's not, you don't have to only use it for like one concept, if that makes sense. So I am going to truncate some of these words. So instead of searching for both cannabis and cannabinoids, I'm actually going to chop off the S on cannabis, and I'm going to add an asterisk, and that's going to find all the words that begin with that. Same thing for chemotherapy. I don't have to look for the singular and the plural. I can just look for anything that begins with chemotherapy. And then if I do that for nausea, I don't have to look for nauseating or nauseated because it'll find those words because I'm looking for nausea plus anything that comes after it. So then we would want to add our field tags to our keywords. So we've already got the field tags for our mesh terms that we were using. So we just want to make sure that we add the field tags for doing a text word search, TW. You could do TIAB for title and abstract if you wanted to. It's just kind of personal preference. So we'd add all those. And then we would add our Boolean operators. So because this is one concept together, we want to find any of these words and any of these words and any of these words. So we'll link all these together with or. We'll link the concepts together with and then we would have the search that we can run. So this is going to find an article that says marijuana and chemoradiotherapy and nauseous. It's also going to find articles that have the mesh term marijuana use and the mesh term drug therapy and the word nausea in them. Right, so when you are building out your concepts and you have all these synonyms and keywords together, you've got all of these words that you link with or, and then you link the individual concepts with and, which ends up looking like this. You've got this first concept, you've got the second concept, and you've got this third concept together. So you could copy and paste this whole thing into PubMed if you wanted to. But what I am going to do is show you how to search the concepts individually. So I'm going to, we're going to go back to PubMed. I'm going to click on the advanced search. I'm going to get rid of the search that I already did. So it kind of keeps a history of the searches that you do. And I'm just going to copy these one by one in to the query. And instead of clicking on search, I'm going to click add to history. So that's just going to pop it down into our search history, and it shows us how many articles are being found. And I wouldn't worry about how many results there are just yet, because we're actually going to be combining a few different words. So we're getting this next concept, add to history. We've got our third concept, add to history. And then you can click on the three dots and click add query. And then each one you would add with add with and. Don't worry about the parentheses, it's just doing its own thing. We could click on add to history, and now we've found the overlap for all three of those. So, good question in the chat. Can we use more than one field tag with the same word, or do we need to use it twice? So you would have to put it in twice. So if you wanted to say cannabis text word or cannabis TIAB, text word does look in the title and abstract, so you wouldn't need to do both of those. But if you wanted to if you wanted to be like really specific, like I'm only looking in the title and the abstract and the keywords, then you would want to put those in individually as well. So we've added all of these searches together and we've got 477 results. The other way that you could do that is to type in the number that the search is. So this is number 1 and number 2 and number 3. Got the same number of results. So this is when you would start looking at those results and seeing like, is this what I'm looking for? Are these articles what I'm looking for? Do I need to adjust my search at all? So let's say that we combined all these concepts together and we didn't find any articles, or we only found like 1 or 2. Sometimes when you're combining multiple concepts, it starts to get a little bit too specific and there might not be a lot of literature out there. So you could start looking for just some of the concepts together and combining them in different ways. So if I look for cannabis and chemotherapy, add to history, we've got a lot of articles, 4,600 articles. If I wanted to look at cannabis and nausea, I could do that. 1,300 articles. If I wanted to look for chemo and nausea, we're probably going to find a lot. Yeah, 26,000. So this can be a way to kind of come at your topic a little bit sideways, a little bit from a different angle to see if there are some ways that there are some articles that you can find that are describing your topic when you are combining the concepts a little bit differently. So that is basically how you build a comprehensive search. The next step would be to look at the search results and refine them, see if it's what you're looking for. If you find more keywords to use, you can go back and add those keywords to your search and run the search again to see what you find. If you're finding a lot of articles that aren't what you're looking for at all, then you would want to look at those articles and see like, why is this one being found? Like, what keyword am I entering that's finding this article? And can I take that keyword out and not miss out on other relevant articles? Oops. So this is just some of the tips that we talked about. Use the advanced search builder. You want to search each concept one at a time. Don't worry about the number of results for each concept. So once they're combined, there's going to be fewer overall. And you can experiment with different ways to find or to combine those concepts. And then you also want to remember that searching is iterative. So you might need to make edits to your search and explore the literature. And that is, we're almost out of time. And that's all I've got for you today. So if you have questions about this, you can email me. My phone number is here. There's also a link here to book an appointment with me, and I'll share these slides with you so that you can do that as well.